0800 448 0828. Anybody across Northamptonshire that wants to call, so professionals, carers, those that are in crisis, and their loved ones.
But we're here, we're free, we're open 24/7.
We've got many people that are able to answer the phone and give you that support. So instead of going to A&E, call us and we will help and support you as best as we can. We can offer sort of that initial emotional support if someone's ringing up in distress or in crisis. We can sort of help in that moment, and then we can make any onward referrals, lots of signposting to things out in the community, or if somebody needs that secondary care, we can look at what that person might need within our services.
That can range from, somebody who's a bit lonely, who just needs a bit of a chat and some emotional support, right up to the other end of the spectrum where somebody is actively, suicidal and wanting to end their life. We have some regular callers that call in kind of daily, hourly. They call in very, very regularly. Being one of the people that they speak to and being able to support them is really, it's good if you can have somebody call up feeling like they want to end their lives, but you end the call and the outcome is different and their feelings are different about that. That's also really super, it makes you feel really good.
As a navigator, you're kind of navigating, I suppose, different signposting options for that person, and you might need to pick up on things they say. So if they say that they're struggling financially, I might be thinking, okay, do they need a debt charity like Step Change? Or if they want to access a crisis cafe, can I send them over the timetable? Or if they need a food bank, if they're hungry and they haven't eaten, let's do a referral to one of the food banks. So as a navigator, we have those options that we can signpost to many. We have a whole directory of hundreds of different services, and I guess part of our job is to have that knowledge so we can signpost to all different third sectors, all different charity sectors. Obviously we can do referrals to NHFT talking therapies, which is like CBT based for anxiety and depression. So obviously that's kind of like your first port of call if you've not had any treatment before.
I am a registered mental health nurse. I would say about 20 calls in a day. However, some people might be picking more calls than me because I am in a role whereby I'm meant to be supporting people who are in a challenging situation with patients on a call. So that's why I said they might be picking more calls than me. So it will be a case whereby something needs to be escalated. I have to be available as a lead practitioner to support them with that calls to be able to escalate.
It takes a lot, doesn't it, to ring up. For a lot of people, they've never asked for help before. And they've got our number maybe through the doctor and they're a bit scared, and they ring up and they say, I'm not sure if I'm ringing the right place, I'm not sure if you can help me. And I think if you can be kind and empathetic, you've made their day better. For any interaction with anybody on the phone, I always send them a text message just to let them know that we're here and they can call us anytime. And for a lot of, I think for me, if I was struggling and I knew that reassurance would probably help me, because I'd think, well, if it gets bad, I can just phone. So even though you're struggling, you're not alone, I think is the message, that we are here and we do care.